So when will it be available for the general public? So right now it's limited, the supplies. It's going to increase over time. They're manufacturing this stuff at, across the country, across the world right now. It's estimated that sometime later this year, adults should be able to have access. But young children, there's not as much research on vaccine effectiveness and safety. So it might be a little bit of time before very young children can get the vaccine. But for adults, it's pretty well tested right now. Again, at least for the Pfizer Moderna ones. And in terms of how to distribute the vaccine, the CDC is advising states to prioritize a couple of groups that are high risk and probably like it's a good bet to vaccinate them a bit earlier. So healthcare workers, they're in contact with a lot of people who may have COVID. Nursing home staff and residents, a lot of people unfortunately have gotten sick in nursing homes. Of course, frontline and essential workers, everything from grocery store workers to bus store drivers to kind of the people who are basically keeping society running at this point, and people over 75 years old. And I'll turn to my colleague Casey to answer this slide.
Yes, so a lot of the decisions about distributing the vaccine are actually being made at the state level. So I wanted to go ahead and just point out where you can find information about Ohio specifically. So if you go to the Ohio Department of Health, they have a page set up for the coronavirus, and they have a link to a COVID-19 vaccination program. Thank you. And once you follow that link, it will bring you to a page that looks like this. And here you can find some answers to common questions related to the different phases and kind of when you could expect them to be rolled out, as well as the different groups, the different demographic groups that will be included in those phases. So if you are interested in, for example, who's in phase 1A, they have some really nice graphics that you can use or look at to better understand that. And then I also wanted to point out that if you have anyone in your community that would prefer to look at any of these resources in another language, they have translated them into a bunch of different languages, and they're also available for Facebook and Twitter if you want to share them on social media.
All right, thanks, Casey. And again, we're happy to answer more questions if you have at the end of the presentation. So who makes the decisions on who will get the vaccine a bit sooner? So one group of people is advising the Centers for Disease Control and Prevention, a group of health experts. And some of the things they're asking government agencies, state and local, to think about are the science, who is most at risk of getting severe symptoms. How are we thinking of this in terms of ethics? Things like communities of color, for instance, are being particularly burdened. So we should probably prioritize how we distribute the vaccine to communities of color and how it's being implemented, how thinking about logistics and supply chain and other types of implementation issues that may occur. But the ultimately, state and local leaders will be deciding as to who would be prioritized for getting the vaccine first and how they will be distributed. So more information is obviously can only be really found on the state websites. So where should I go to get a vaccine? It's the places you probably would expect, so doctors' offices, pharmacies, hospitals, qualified healthcare centers. So you basically need to, again, look at your local government websites for more information, but this is the general place you'll probably find them. So are there risks associated with getting a COVID-19 vaccine? And the answer is kind of what I've highlighted a little bit before, which are there's common side effects like pain at the injection site, fatigue, headaches. They tend to be pretty minor and go away within a few hours or a few days, but things you might expect, again, if you go to any other flu shot. And one interesting thing to note is if you get these symptoms, they might suck a little bit, but it's also a way of showing that your body is literally building immunity to the virus and the vaccine is working. What are the risks associated with not getting a vaccine? So unfortunately, the risk is you or your loved one may contract COVID-19. And while the disease is not it can be mild in a lot of people, it can also be very moderate or very severe in a lot of other people, and your body may not be prepared to fight it off. So here are symptoms of COVID-19. I'll point out that you can have long-term symptoms for weeks or months. You may be unable to work, hospitalized. Unfortunately, death is also associated with COVID-19. So trusted sources you can go to. So yes, there's a number of them. These are actually the places that we got most of this information for this presentation. I'll also point out that Ohio is on this list, the Ohio Department of Public Health. And should I get vaccinated even if I don't have risk factors? This is a question for Casey.
So I know early on in the pandemic, we kind of were thinking that, oh, maybe if you're younger or you don't have pre-existing conditions, oh, you don't have to worry about COVID. But when it comes to the vaccine, and as we've learned, COVID in general, the more people who get vaccinated, the more likely it is that we will be able to slow or stop the virus. And in the end, the vaccine not only protects you, but also those around you who may be more vulnerable. And we have a graphic to kind of help to visualize this. I personally am a very visual person. So if these dots were a community where there's no immunity, so no one's ever had COVID-19, no one has gotten a vaccine, the pink dots are COVID kind of spreading throughout the community. It can happen very quickly and it can spread to a large number of people in the community. Compare that to a community where some people have immunity, which is represented by the gray dots. Fewer people are able to contract the disease because those gray dots kind of block COVID from getting anywhere. And then in a more ideal situation where 90% of the community is immunized or has immunity, we can actually contain COVID and eventually stop the spread and hopefully stop the pandemic.
And to carry on with Casey's point, how many people need to get vaccinated to prevent the spread? We estimate, or I should say the best minds in the country and the world estimate that around 70 to 90% of the population will need to be immune. Now, immune can include people who've had COVID-19 in the past, and they're right now they're have immunity, or it'll include people who have been able to, who've gotten vaccinated more or less. And the main issue that we wanted to highlight is that if we want to stop COVID-19, the vast majority of the population will probably need to be vaccinated. So if I get vaccinated, do I still need to social distance or wear a mask? So the answer is yes. The science is a bit uncertain. If you're vaccinated, can you spread the virus to others? There is some evidence, preliminary evidence, showing that the vaccine can prevent someone from giving the virus to someone else. So we think vaccines are pretty good at stopping what's called the train of the spread of the disease, but there's still kind of some research in this area, and it's just best to be on the safe side and social distance and wear a mask. So people who've already had COVID-19, you are eligible to get vaccinated, and the data is saying that it's safe for you, but there's less firm conclusions that can be drawn of how protective it is for you. So, but the one thing to note is that if you actively have like the symptoms of COVID-19, you should get vaccinated. You should wait till the symptoms are over and you're actually fully recovered. And you may have some protection even past having those symptoms. So importantly, talk to your doctor if you've already had COVID-19 on whether to get the vaccine. So we wanted to sum up here. What are things you should think about when making this decision? So your risk of getting COVID-19 are you at increased risk for severe symptoms? Are you in contact with many people each day? Can you walk home? Can you work from home? These are all important questions. Your risk of spreading it. So are your loved ones at increased risk? Like say if they're a bit older or if they're immunocompromised. How would you feel if you accidentally gave COVID-19 to a friend or a loved one? The people you contact, your neighbors or essential workers, spreading the virus that way. So in terms of the safety and effectiveness and availability, it's been tested for these things. It's shown to be 95% effective, very few side effects, tested in a lot of different types of people, and it should be available to you without charge at a nearby facility. So to end the pandemic, it is believed that a large number of people would need to be vaccinated. And that's your presentation. So I will stop sharing.